Well, if you have had children or perhaps you've lost some weight recently and you find that you have that extra skin that should not be there, well, what are your options? Liposuction or tummy tuck? Dr. Patti Flint, board-certified plastic surgeon, is here with some sound advice to figure out really what procedure is really right for you. Good to see you again, Dr. Flint.
You as well, Terry.
Okay, so those are two of our options. How do we know? And I think a lot of women don't know. They just come to you and they say, get rid of it.
Right, exactly right.
How do you determine what procedure is best for us?
Well, a physical exam is very important. I also want to hear what the patient's goals are. But you really do need to see a board-certified plastic surgeon to determine which procedure is right for your goals.
Right. Okay, let's take a look. I know that we have some before and afters of some patients that you've worked on, and each procedure is a bit different. So tell me what you had to do with this patient.
This gal's in her late 60s and was very active, but was frustrated by the lack of tone in her abdomen. When I examined her, I noticed lax skin and lax connective tissue, so she needed a tummy tuck. Liposuction alone would not have snugged up that skin for her.
Ah, and you know, and I think that's the thing for us to learn from you is that liposuction, you said, does not fit does not work for sagging skin.
That's right. If the skin's already loose, it's just going to become looser if fat is removed from underneath it. So then removal of skin with a tummy tuck is the best option.
I see. Okay, let's take a look at the next patient and tell me what obviously loose skin.
Yeah, this is a perfect example of this. Mom in her early 40s, 3 children, lost 20 pounds, very lax skin with stretch marks. Stretch mark skin is damaged. It's not going to tighten up. So we did a tummy tuck, snugged the skin up, tightened up the underlying muscles, and she looks like her pre-pregnancy self.
Oh my gosh, she sure does. How old is she?
Early 40s.
Wow. Now, does age matter when it comes to something like that? I mean, obviously, the younger you are, the better chances of a quicker recovery, but what about skin elasticity?
No, it does change with age, and I think once we hit our 6th decade, usually skin tightening is in order.
That is an incredible before and after. And what are we talking about with downtime with something like this, with the tummy tuck?
It's not as bad as most people envision, probably about 10 days off work for most people, but up and around certainly the day after surgery. No lifting for 6 weeks, but very tenable recovery for the vast majority of patients.
Really? And what about liposuction?
About 4 to 5 days off work, about 3 weeks of no lifting, a little soreness, but really not bad at all.
Do you ever do both? Do you ever do a tummy tuck and liposuction?
Absolutely. Liposuction is a great tool for tailoring the back hip area, the love handle area, and I use it in almost every tummy tuck patient.
Now, we saw a lot of before and after pictures, and you can clearly see in the before, you can see the skin sagging, but I want you to take a look at this before and after picture here because you don't really see a lot of sagging skin, but you know, obviously she's got a pooch that is tough to get rid of.
Right, very athletic girl in her late 30s, no children yet, so good quality skin, never been stretched, so to speak, with pregnancy. Perfect example of someone who liposuction worked great for.
Ah, okay, so she was just liposuction.
Just liposuction.
If you could go to that next before and after for me, because there you can really see where, and most people wouldn't think that liposuction would work for a lower tummy like that. I'd be going in going, tuck it.
No, she has great abs under there. She works out all the time. The skin was nice and snug, but she just had a little extra subcutaneous fat in that area that was genetic primarily. So the skin snapped back beautifully, and she got a great result with lipo alone.
Now, when somebody comes into your office and saying, you know what, I've got this extra skin, I've got that pooch, I've got this or that, who is not a good candidate for liposuction or a tummy tuck?
There's a high risk in smokers of healing problems and blood clots, so we ask people to quit smoking before surgery. And also, if you're significantly overweight, better idea to get in better shape before you have an elective procedure.
Absolutely. Less downtime on top of it.
Exactly.
All right. Well, good information. Thank you, Dr. Flint. And let me tell you about a special offer that if you decide to go in for a consultation to see Dr. Flint, mention Sonoran Living Live when you book that consultation, and you'll receive $100 credit towards your surgery. She has 2 locations to choose from, Old Town Scottsdale and 1 in Mesa. To book your appointment, 480-945-3300. You can also learn more by visiting pattiflintmd.com.